Hi, I'm Dr. Carl Engelbart, and I'm going to talk a little bit about facial cosmetic surgery. As we age, there are a lot of changes that occur in our facial structures that a lot of us find to be somewhat less than desirable. The first areas that are usually become a concern are the eyelids, and this usually starts somewhere in the 30s and 40s when we start noticing that we have excess upper eyelid skin, which forms a bit of a hood in the upper eyelids and sometimes makes it difficult to wear makeup. This is usually the first problem that brings people in to see a cosmetic surgeon. In addition, the lower eyelids develop some crepey loose skin and some prominent bulging fat deposits. And then as we continue to age in the lower eyelid, oftentimes the lower eyelid tissues begin to thin out and we develop what's known as a tear trough deformity, which is a loss of tissue and a hollowing out of the lower portion of the eyelid where the eyelid joins the face. Eyelid surgery is very successful surgery. Upper eyelid surgery we do in our office operating room a lot under straight local anesthesia with a little oral Valium sedation. The lower eyelid surgery is a little bit more difficult, but certainly can be done under local anesthesia. A lot of times we combine upper and lower eyelid surgery or upper and lower blepharoplasty with other facial procedures, and a lot of times we do this in the hospital operating room when the surgery becomes more involved. As we continue to age, we start having changes in the face that become undesirable. Early changes are drooping of the eyebrows and deep facial folds called nasolabial folds. We also get deeper wrinkles in the skin as the skin loosens and loses its tone. We develop jowls, which are pouches of skin along the lower jawline, and then we develop excess skin and wrinkling and folds in the skin of the neck. And when these changes occur and develop as we continue to age, usually facelift issues become more common as we get up into the 50s and 60s and beyond. Early on, some of these facial changes can be addressed non-surgically with the use of Botox to paralyze certain facial muscles, and which can eliminate some of the wrinkling. We also can resurface the skin in several ways. We can use lasers to resurface the skin or chemical peels, which I prefer. And in addition, as we age, a lot of times there's atrophy of the subcutaneous tissues of the face, and we use fillers. The filler that I most commonly like to use is fat, because fat is something that we all have plenty of excess of, and we can use this, and it's our own natural tissue, and the chances of having problems using one's own fat are less, I feel, than using the various other fillers that are on the market. Eventually, as the changes become more and more prominent, we're going to need to have surgical procedures such as face and neck lifting. There are all sorts of techniques for facelifting that have been developed over the years, and most likely there is not a whole lot of difference in these facelift techniques. And what's important is how well these techniques are performed and the artistic creativity of the surgeon. I was at a plastic surgical and cosmetic surgical meetings a couple of years ago when a very prominent cosmetic surgeon, Dr. Joel Feldman, who practices in Boston, gave a talk about a study that he did where he compared all of the various types of facelift procedures. And he said that over the course of his almost 40 years of practice, he's done all the different types of facelift, and he studied all of his pre and post-operative photographs and came to the conclusion that it really didn't make much difference which technique he used, and as long as it was well done, the results end up being fairly equivalent. Lately, there's been a lot of talk about more minimal facelift procedures, which are called mini facelifts. And these are very effective for younger people that are primarily concerned with facial aging and don't really have much problem with their neck skin. These mini facelifts are shorter procedures. They're less complex. There's less potential complications, and they're very effective when the problem is confined to the face and doesn't involve the neck. However, if you have a lot of excess neck skin, then you need a full facelift. We do facelifts in the hospital under general anesthesia, and we usually have an overnight stay. The reason that I like to keep people in the hospital overnight after a facelift is because the most common complication after a facelift is a hematoma, or a collection of blood due to bleeding underneath the facelift skin. If that should occur, almost always you have to go back to the operating room, and the stitches have to be removed, and the source of bleeding has to be controlled. I found over the years that by keeping people in the hospital after a facelift, the chances of that are greatly diminished. You're brought right from the hospital operating room to your own private room where your needs are taken care of, and you don't have to look out for yourself, and you don't have problems arise that might arise at home that can cause you to spike up your blood pressure or get upset about something, and this might cause the bleeding to occur. The other problems that can occur with facelift surgery are healing problems, and one of the biggest contributing factors to healing problems is smoking. I absolutely insist that somebody does not use tobacco products within 6 weeks of a facelift. And I mean absolute stopping of all tobacco products, because even one cigarette can be enough to constrict the blood vessels in the skin of the face and cause healing problems. In addition, there can be problems with scarring, which can usually be dealt with. Facelift surgery has been I've found to be very effective surgery, and it's a type of thing that may not add years to your life, but it can certainly add life to your years. So facelift surgery is very, very effective surgery. It's usually very safe, and we've had good experience with this over the years. So if you're interested in facial aesthetic surgery, I've done a lot of this over my 30 years of practice in Schenectady, and I'd be very happy to meet with you. Thank you very much. Good night.